Hi, my name's Anthony. I'm from Southern Suburbs Physiotherapy Centre. I've got Emily with me today and we're going to look at some lateral ligament taping of the ankle. So this is one of the more common injuries we see in the clinic. So I've got a foot here. The lateral ligament is on the outside of the ankle and it's a couple of little flimsy bands. It's commonly injured when the foot rolls inwards in sport and these ligaments become damaged. So the taping that we're going to do today is going to be to stabilise these ligaments and give a little bit of support. Now, if somebody was going to have the tape on for a period of time or they were sensitive to tape, then we would use the DonJoy underlay and that gives the skin a nice protection with the tape. But for today's example, we're just going to use a rigid, which is what we do most of the time for people during their sporting activity. So first of all, we just make sure all the skin is clean and dry. Emily will pop her ankle up to a right angle here, so in what we call the neutral position of the ankle. And we start with an anchor strip which runs basically at the top of the Achilles or the bottom of the calf. So we don't want the tape to run over the Achilles, or you can get a tape cut. And when we're taping the lateral ligament, there's a couple of other landmarks that are quite important as well. So the lateral malleolus here, we actually do want to tape over because that's where the ligament comes from. But there's a bony point that you can easily feel on the outside of the little toe, and we don't want to tape over that because that's another risk of a skin cut. So to start with, we're going to pop an anchor strip around Emily's lower shin or upper ankle on a slight angle. And from there, we're always going to start on the opposite side to where the pain is. So Emily's injury is on the outside or lateral side of the ankle. We're going to run the tape from the inside, and we're going to make sure that the tape is over the back half of the lateral malleolus. So as I tape, there's going to be a little bit of that bony prominence exposed. We lay the tape down nice and smoothly, make sure she keeps her foot at that right angle. And I'm going to do 3 of these stirrups to start with. On the inside again, coming up, laying down directly over the top of the malleolus so it's fairly much fully covered. And then I'll do a 3rd stirrup, coming down and just to the front of the malleolus. So when we're taping and doing 3 stirrups, we just want to make sure that each segment of the tape covers about 1/2 to 2/3 of the section below, so never one strip right on top of the other. Now, if we're doing quite a basic ankle taping, we might just do 2 or 3 stirrups and we'll do a figure of 6 to finish that off. So that also starts on the inside aspect of the ankle, comes up, we rip the tape a little bit longer because what it's going to do is come across and finish up where we started, back on the inside part of the ankle. So again, we just need to be a little bit careful here that we're not taping directly across the ankle crease here, because that can also react to the tape. And with Emily, I'm going to do one going the other way as well, just to give her a nice even joint stability. So this one is starting on the outside, coming underneath, and you'll see that I'm finishing right up literally over the point that I started on. Now, for more acute ankles or people that are returning to sport just after an injury, we find often the best taping technique is what's called a heel lock, and this is the most difficult of the taping techniques to do, but you've just got to follow a fairly simple process. So for a heel lock, we start on one side of the ankle, so I'm starting on the inside of Emily's ankle. I'm coming down and bringing the tape underneath the heel. Now, with some heel locks, some people prefer to go behind first. It doesn't really matter, but in this example, we're going to come under, below the heel, behind, and head back up in the same line of direction that we started. And that gives us half a heel lock, and then we need to do the other side as well. So I'll start on the outside of Emily's ankle. We'll come down, I'll head the tape down to come underneath the heel bone, then take an angle behind the heel bone, making sure I miss the Achilles, back up in the direction I started, and we've got a nice heel lock each way, and that really gives the ankle some very good support. We'll always then finish the tape off with another anchor over the top, which holds it all into place. So again, just on a slight angle, Minimal pressure as you go around the shin because you don't want to cut off any circulation. And there you have your lateral ligament taping for the ankle.